It's attainable now in Canada for our patient to achieve remission. In our CATCH database, 60% of the patient achieve remission and 80% achieve remission in low disease activity based on the CDAI. So this is pretty good actually. At 1 year, 80% of our patients reach remission. And we have to know that we're using these disease activity score, and sometimes when you look at remission score, there is no inflammation, but the patient is not quite into remission, sometimes for other reasons, such as pain for other reasons, not necessarily inflammatory pain. So this is maybe one of the reasons we don't reach remission to all patients. But there's still some patients we cannot reach remission. They still have eye disease, inflammation, a swollen joint count that is not well controlled. So when you look at the CATCH database, there's some study, Korea published in 2012, and Dr. Shear also published an abstract in 2019. Then they showed that there is a lot of variation on the proportion of patients achieving remission depending on the disease activity score that you use in clinic. So if you use a DAS28, you're going to have much higher number. If you use the Boolean remission, you have much lower number of patients achieving remission, but this is a very tough criteria to achieve in clinic. So I think that, for clinician, the CDAI or the SDAI are really those disease activity score that we should use as clinician in clinics. And especially the CDAI, very easy to do. You don't need a lab test, you don't need a CRP to do it. And I think the CDAI, if you compare to the DAS28, represent more accurately the proportion of patients in remission, because you can have a DAS28 remission with a lot of swollen joint. So CDAI, you cannot have more than one tender or swollen joint count. So I think that CDAI reflect more the proportion of patients into remission.